So I'm Carl Hasselman, and we're going to talk today about the new Knotless mini TightRope at Arthrex. What I'm going to do is a lot of times if I put my forceps into the first tarsal metatarsal joint, I want my TightRopes to be distal to this because I know my plate's going to be here, so I want to be a little distal. So I know that I basically want my TightRope to kind of go in this area. So I'm going to make my incision just lateral, and I mean 2 millimeters lateral to where I just marked, and make it long enough so that I can get down. Once I have this exposed, I'm going to put my pins in. We want to actually be able to pass 2 of these. So what I'm going to want is I'm going to want the ability to pass 2 separate buttons across. So the first one I'll make slightly at the proximal end of my incision. I'm going to take my finger and I'm going to pinch the first metatarsal head and the second metatarsal head, and I'm going to reduce my IM angle, and I'm going to hold them so that they're basically together and they're in the same plane. And then I'm going to pass it across. When I pass it against the fourth, you can see my wire coming out the other side. So what I want to make sure is my pin is going to be away from where I'm going to put my plate. You can see on this x-ray where the pin has passed across from the second to the first metatarsal. My sesamoids are anatomically positioned with this technique already. Now I'm going to put my Homan back in and go just slightly distal with a second pin. So you just don't want to put these 2 wires on top of each other. You want to actually have some space between them. And the space, all you have to have is enough space is the width of this part of the arrow right here. And what I'm going to do is I'm going to drive it through. I'm going to come back and I'm going to look at the medial side. And I just want to make sure as I look on the medial side that there's no soft tissue trapped up. You can see that when I have both of my wires sticking out, they're both coming out of the bone and there's no soft tissue trapped up around the wires. And so now I have my wires and they're spaced far enough apart that the buttons won't hit against each other and you can rotate them so they'll be out of the way. You can see you have 2 wires traversing from the second metatarsal to the first metatarsal. Again, you can see your sesamoids are anatomically reduced. And now it's just a matter of passing your buttons. So one of the things I'm going to do is I'm just going to pull it back a little bit more so that now once I get past, now you can actually see this thing will slide very easily back and forth. And so what we're going to do is we're going to take a shuttle and we're going to pull the shuttle through so that we can pass our mini TightRope across. This just makes it a lot easier. You could actually try to pass them through just on the wire, but I've found that a lot of times that's a lot more difficult. And so again, I'm going to pass my second loop across. So now I have both of my loops. So now what I'm going to do is I'm literally going to shuttle my mini TightRope across to the lateral side, and I'm going to pass it across. And here's what you can see. It's a very small 1-1 hole, and look at all that suture that we're going to pass through. So you're going to feel your hole quite nicely with the mini TightRope. Then you're going to take the second one and you're going to pass it through. And as you pass it through, again, you'll notice the loop itself actually goes through quite easily. And so when you have loop 1 and loop 2, you're going to nicely take the arrow and you're going to loop it around 1 loop. So your distal loop will go on the distal side of the arrow and your proximal loop will go on the proximal side of your arrow. And as you pull on both of these, you're going to bring your arrow down. I want my arrow to lay flat against my second metatarsal shaft. So I'm going to take and free up the soft tissue a little bit distally. And now my arrow is going to sit on my second metatarsal. Once that's done, then we can pull these nice and snug. You can see my arrow sitting nicely down on the second metatarsal. And you can see how I'm going to distribute stresses. This stress is going to be distributed along the entire length there. So we're not going to have one focal point on the second metatarsal. We're going to have it distributed evenly. But once you have the arrow sitting on the second metatarsal shaft and you're quite happy with that, you're going to take your button and you're just going to slide it down, all the way down, holding the other strands, basically so that it's just down against the metatarsal. And by doing that, you're going to make sure you don't bunch the whole thing up. And it's just going to sit down on there. And then you can actually begin to grab both lines of the mini TightRope. And as you take these handles and you pull, you're going to be cinching this down. And if you notice that it looks like it's getting bunched up, you can use your rescue loop and pull back, basically to make sure that you're comfortable and you're going to continue to pull. And as I pull, you'll see I'm making sure that all the slack in the system is out because we don't want to leave slack in the system. And now I'm going to pull nice and snug. And when I pull this down, the neat thing about it is, as I pull this down, it's going to literally cinch this down. I might even give this one more tug. Once I've done the first one, then we can actually repeat that for the second one. You can see that our first button is already down. It's sutured. It's nice and tight. It's secure. We're going to take our second button and we're literally going to just slide it down until it is against the metatarsal. And you'll see that it wants to bunch on itself a little bit, but I'm pulling on all the strands and I'm going to push this all the way down until it's nice and it's on the metatarsal nicely. Then we're going to take it. And again, each of us will grab a strand. And as we pull, you can see what's happening. And if you see a little bit of bunching, you pull on your rescue, gets the knots out of there. So now you can see that we have both tight ropes down. And so I'm going to take a quick x-ray. And you can actually see there, the intermetatarsal angle is anatomically reduced. The sesamoids are perfectly reduced. The capsular closure is nothing more than a cosmetic procedure. This is an incredibly stable technique with minimal invasive incisions.